here with Leddi. She lives in Johannesburg in South Africa, and she tested positive for COVID-19. And so I just wanted to find out your experience of having COVID-19 in South Africa and like the treatment that you've received or not received, and how you found out that you had it, that sort of thing. So if we take it from the start, what happened?
Okay, hi Vanessa. So essentially what had happened was I woke up on a Sunday in the UK. I'd gone over to go visit my family, and I woke up in London on a Sunday. I think it was Sunday the 15th, and I felt this really it was like a heavy feeling. It almost felt like somebody was sitting on my chest, and I couldn't get full access to breath in my lungs. And because I'd had a conversation the day before with a whole bunch of friends about like the symptoms, and we'd all established that one of the most significant symptoms was difficulty breathing or shortness of breath. I found it like, I actually thought I was surely making it up in my head. I was like, there's just no way that like I've just spoken about this and I've woken up with a symptom. So went into panic mode, blah, 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 trying to figure it out, trying to figure out my way around the NHS, which since I'm not a British citizen and I didn't really know how it worked, and on top of it, at the UK at that point was like doubling in numbers, and like hospitals, you know, had no room for anybody, and you know, you were on the line for like over an hour. They were talking about, you know, we don't know when we'll answer the phone, so you know, you've got to really be sick to be calling. And me being South African and like hearing this, I was just like, no, okay, I can't stay here. So called, got some advice from my family, booked a flight that night, and flew out with my first symptom, but obviously all masked and gloved up. But yeah, that very next day on the Monday, I then tested and I waited for my results in that period.
So
And
the
then,
testing, so did you have to pay for that yourself?
yeah, so on this side, well, I mean, it depends. So you can either go private or you can go public. And at the time, I wasn't really sure. I thought that the public system might be inundated. I wasn't really sure of what was going on, so I just decided to go private with my doctor. And so, yeah, he gave me a script, because the only way that you can get tested is if you go to a doctor first, get a script, and he says that you need to be tested, and then you go to the laboratory to get tested. You can't just go straight to the lab if you want to.
So how much was it for the test?
1,400. Yeah, so yeah, I got tested, and it was essentially just like a really, really long earbud going your nose. Like not even into your nose, like it felt like it was going into my brain. It just goes right past it, and then they yank it out, so it's a really sharp feeling, very uncomfortable.
Oh no. And so when you go there, are the people wearing masks that are testing you? And are they all like, have they got all the gear on?
Okay, so now if you're looking at the dates of the time that I got tested, the 16th, right, of March. So that was literally just after the World Health Organization had like announced it as a pandemic on the 12th. And our country, our president, Cyril Ramaphosa, had only made the announcement that night before, the same night I flew on the 15th. So when I got to the doctor, like it was, they took, like, you could tell that they were trying to take it like seriously, and trying to like be like, you know, obviously wearing their masks and stuff, but there were like little things, like at the lab the nurse wasn't wearing gloves, and I remember just even I took a photo of it, and she even commented, don't take a photo, I'm not wearing gloves. And I remember finding it so weird that she knew that it was wrong that she wasn't wearing gloves, but still wasn't wearing it at the same time. So I think that there was a sense of like not really understanding just how big this thing was.
Mm-hmm.
So probably a laxy-daisyness around, you know, like protection or safety.
Because if we think about that, if she's testing you and then she's potentially testing other people.
Yeah, like, and the worst thing is I'm positive. So like, I mean, obviously we later find out that I'm positive, but I mean, she's gone and she's like, you know, touched me. And then the next person she's going to touch, or for all I know, you know, someone that she's touched and they touch me. And then, I mean, it's just...
Oh my goodness. Okay, so yeah, so after you got the test, what happened after that?
Okay, so then I get home and I go straight into self-isolation, which was quite interesting because I was meant to get my results within 2 days. But 2 days go by, that's Wednesday, they call me to tell me that the results aren't ready yet. So I was like, okay, sweet. They said they'll be ready by tomorrow, Thursday. Call me again, not ready. I call them on Friday now. I'm like, okay, what's happening? They say that the lab is backlogged and that there's too many tests at the moment. So hopefully I'll get it over the weekend. Weekend goes by, I'm still a sitting duck. Monday comes, that's like a week from the date that I tested, and still nothing. And then Tuesday evening at 7:30 at night, the guy, my doctor, calls me and says, listen, you've tested positive. So, I mean, if I had not had some of the information that I'd had, I could, and there are people that went and got tested, didn't get the results, and then were like, oh, well, no news is good news. And then, carry on living their lives and running around with everybody else. But just because I was just so sure that something wasn't right. And it wasn't even like I was feeling sick. I didn't have like a fever. I didn't have like, sweating, none of that really. Like, I just knew that the shortness of breath was a big enough sign to stay in self-isolation, which I did. So when he called me, I mean, it wasn't any breaking news. I was like, great, I've been vindicated. Now what do we do after this?
And did he give you advice on what were the next steps for you?
So that was like, the big question. I was like, okay, now that we know that I'm positive, what happens now? And he was just like, you carry on doing exactly what you've been doing. And so I was like, okay, I thought, well, I mean, there must be some kind of antibiotic that I should be taking, or, but he was like, no, literally, you're treating your symptom to symptom basis. So he says, so if you get a headache, do something for that headache. Take a Panado, take a paracetamol. If you break out in a fever, treat the fever. If you have a sore throat, take lozenges. Like, it was very much treated symptom to symptom at that very moment that symptom is striking you. So that's essentially what I did. I'd already bought medication as it was. So I just kind of like self-medicated as I would in a normal flu,
And how have you been feeling since then? Because now it's been quite a few weeks that you've had it. How have you been feeling from like the moment you got it until now?
So, okay, cool. So it was like the first week was pretty tough. I woke up like some of the days with like a really stiff neck and a stiff body, as if I'd like gone to the gym for like hours the day before. I also had headaches that would go in and out. And I think the shortness of breath was the most significant thing. I've also felt dizzy at night, and I would feel very exhausted. But the exhaustion only really struck me the second week. But yeah, it was also the shortness of breath that kind of like really bothered me. It's like that feeling of not being able to like completely it's almost as if someone's clamped the bottom of your lungs, and then you're trying to draw breath and you just can't get to that last 20% that you really need. But since the date that I got tested, and now I've kind of like been learning on the go, like little home remedies and stuff that I do using a humidifier and steaming, kind of like patting my back to loosen some of the congestion in my respiratory tract, and taking medication, mucolytics, to break down the mucus in my respiratory tract. That's been really helpful. And at this point, I'd say that I'm probably setting it around an 85%, which is pretty good. Like, I'm feeling like I don't have any of the other symptoms anymore. It's just this last bit of congestion in my chest still, but otherwise I'm feeling pretty good.
That's good. But it's been quite a few weeks to be feeling like that. It must be quite difficult.
Yeah, it's been 21 days officially.
Oh my gosh, that's quite a long time. Especially
Yeah,
since people are, well, like the guidelines here is 12 days, which can be quite confusing when you're saying, you've probably had it for 21.
yeah, so that's the thing about it, is like, okay, for example, like here we're on a lockdown, a 21-day lockdown, and they're saying the 21-day lockdown is an assumption around like the period of incubation, and
Yeah.
then like you kind of getting over it. So like 21 days is like a safe zone of like, you likely not being able to, like, if you were going to infect somebody going in, coming out of it, you're likely not going to. I would say that I don't know, because I haven't tested. I don't know if I'm negative, and I don't like. I think, and I think I was reading up somewhere that, you know, this particular symptom, like this, like the chest bit, it might not even have anything to do so much with the fact that I'm like still contagiously carrying the virus.
Okay.
It's
Yeah.
just kind of like trying to, like, my body's trying to just get back to like normal. Probably just sitting with like mucus that just kind of like needs to come out. But yeah, I won't lie, like 21 days, this is probably the longest that I've ever felt any kind of like ailment in my life. So
Oh my goodness. And so do you live with family or do you live on your own?
I live with my mum, and that was kind of like the hardest part of like trying to self-isolate, is because first of all, my mom just does not listen, because she's an African mom. So obviously she's like barging in the door and being like, oh no, let's see, I need to do this. But also just in common spaces, in the beginning, I think it was like, okay, she was going to cook food for me. But I mean, it obviously becomes unsustainable to be cooking food for me like every single meal for the past 21 days. And so we'd have to kind of like make up like rules, like, yeah, like a schedule. Like, okay, you going into the kitchen, then she like knock on my door and be like, I'm done. And then, you know, I kind of walk into the kitchen, and like everything now we have to like hand sanitize and like wipe down surfaces to make sure I don't like make her sick. Unfortunately, I didn't actually infect her, which made me really happy, because I, at some point, I actually thought I had.
Oh, that's so good that she didn't get it.
Mm.
Did she get tested for it?
She did. She got tested, and it was interesting because I think she had a cold, and then she saw me and she started mirroring a lot of my symptoms. And so there's like such a psychological thing at play with this, like, you know, virus, because I just never seen anything like it. She ended up she ended up going to the hospital because she felt so unwell, and then got tested only to discover she was negative. So I kind of had a chat with a psychologist, because I was like, okay, what is going on here? And I think we've like established that one of the biggest symptoms is anxiety through this entire thing. A lot of people assume that they've got it, or, you know, hearing the symptoms conflate things in their head, and it's just a psychological reaction. And more than anything, for my mom, it's like this term called psychosomatic, where you start to exhibit symptoms that they're born of, you know, from your, they're born psychologically. And I think, you know, the psychologist also said that she probably has such a high level of empathy for you, because you're her child, that, and you're in a close proximity, that she's watching you, and she's literally just picking up everything that you're, like, your energy, she's picking it out, which, I mean, I felt terribly guilty about.
I mean, it's not your fault, obviously.
Yeah, no, I know it's not my fault, but I mean, I felt so sad, because she looked at some stage so sick. And then, but I was really, really happy to find out that she tested negative.
Oh, great. So is she back home? Like, is she feeling better now?
Yeah, she's feeling better. She's bobbing about doing the stuff that she does.
And so how is South Africa, or Johannesburg specifically, dealing? I mean, I guess you've not been able to like go out to see what's going on, but how are they dealing with the situation?
Well, I think nobody here has been able to go out, because we've been on a lockdown since the
Okay.
27th of March. We pretty much kicked into it. Like, so essentially, I think we hit the 400 mark in terms of people that have been infected. There weren't even any deaths. But because we're a country that potentially, we don't know how the virus is going to react to people with HIV/AIDS and people with tuberculosis, and we have the highest rates of those in the world. So I think our president made a really good call by not trying to test how far we could push ourselves. And I think that's probably some of the weakness of like countries like Italy, is that they waited until the numbers were just already like through the roof before they reacted.
Yeah.
Obviously it was a first time situation, so nobody can really make good decision making, because you've never dealt with something so mad, a pandemic. But yeah, so our country kind of went into lockdown from the 27th of March. And from what I understand, it's actually been helping to flatten the curve. And I don't think that our public healthcare systems are inundated. I think our private healthcare systems are probably inundated because it's just people that are just like, panicking. And a lot of private healthcare members would be people that would have traveled. And that's where the majority of the people that got tested. So yeah, for sure, the private healthcare system, just for the fact that my results took as long as they did to come out, you just know that, that system is like kind of like jam packed. But I don't think that the public healthcare system is necessarily struggling as much, because I think we've slowed down local transmission via having the lockdown in place.
And
So,
for the public healthcare system, can people get healthcare for free in Johannesburg?
yeah. So
Wow,
you can get your tests for free, you can get your healthcare for free, but I mean, there are obviously disadvantages to being in the public healthcare system. I wouldn't say that it's the most functional. Like, if it's really full, if it's really like, like, luckily for the lockdown, because there's a lockdown, there's like less of everything. So there's less car accidents, there's less, other casualties and all sorts. So I think there's a lot more time and room and energy and space for doctors to be able to concentrate on the current issue. But on the average day in the public healthcare system, it's like jam packed and there's a lot going on. You could wait for hours for treatment in some of the hospitals. So yeah, it's good, but it's a lot for that system to have to carry the majority of the country.
Yeah. Thanks so much for sharing with us. I'm so glad that you're starting to feel better, and hopefully you get to 100% in the next, as soon as possible.
Thank you so much for having me and having the conversation. And I suppose really it's just a matter of, I think, like, my final message is just, I really believe that the best way to take care of or deal with the situation is just to take care of yourself. I think there's no way that we can go back to the same practices that we had originally. We're going to have to really start taking personal hygiene as a serious thing. And I think that's just the best way to be able to take care of those around you, is literally to just make sure that you yourself are protected in the best ways possible.
Yeah.
So yeah.
Great. Thanks so much.
Thank you so much, Vanessa.